Hi, my name is Ariana and I'm an FSCJ nursing student. Today I'll be doing a IV medication via Piggyback. Before I get started, I'll look at my physician's orders to look at the right medication, the right dose, right frequency, and right route. And I will also assess my patient's laboratory results and any allergies that they might have. Okay, so now I'm going to go ahead and get started. My doctor has ordered for my patient to get Phenergan, which is at 12.5 milligrams IV every 6 hours PRN. I have 25 milligrams per milliliter, so what I'll do is I'll take my 12.5 divided by 25, and that gives me 0.5 milliliters. To get my drops per minute, I will take my total volume of fluid, which is 50 milliliters, divided by 15 minutes, which is the time it's going to be diffused, times 10, which is my drop factor, and that gives me 33 drops per minute. And here's my calculation. Okay. And the whole purpose and the action of Phenergan is that it acts on the chemoreceptor trigger zone to decrease vomiting, and its purpose is to pretty much bring down nausea and vomiting. And its recommended dose is 12.5 to 25 milligrams every 4 to 6 hours. And side effects include blurred vision, drowsiness, dizziness, and dry mouth. And it's contraindicated with alcohol, most drugs that are used for sleep or anxiety, muscle relaxants, and narcotics. For nursing interventions, I would assess my patient's respiratory status, monitor intake and output, and provide 2 liters of fluid per day, and avoid alcohol at all costs. Go ahead and leave this on the side. So now I'll go ahead and perform hand hygiene, and I'm going to go right ahead and infuse my 0.5 milliliters into my bag. Okay. So I'm going to go aspirate for 0.5, like so. Go right ahead and clean my Phenergan. And before I get my medication out, I'm gonna make sure to look at my drug and make sure that it's up to date and has not been tampered with, and it looks great. Once again, I already have cleaned it, so I'll go ahead and infuse my air in there and take out 0.3 milliliters, and try to avoid any air bubbles at all costs. Try to flick them out if there's any that may have formed. Okay, so this time I'm going to go ahead and fish for my needle. Okay, and I will take my my bag of fluid here, and I will make sure to label it with my drug name, which was Phenergan, and the patient's name, the dosage, and the frequency of administration, and my initials, and of course date and time. And I will make sure to clean it. That will go right ahead and infuse that right in there. Fish from my cap. And dispose my needles in the sharps container. And I'll make sure to shake my bag so the medication can mix well. At this time, I'm going to go ahead and label my tubing as well, and with my date, time, and initials. Done. And I will take my belongings and go into my patient's room. So before I go into my patient's room, of course I will knock, and then I will introduce myself to my patient. I'll go ahead and perform hand hygiene. I'll go right ahead and ask my patient for their name and date of birth, which I will compare with my MAR using their wristband, and that does check out. I'll also make sure to ask my patient for any known allergies that they might have or that they might know of. And then at this time, I'm going to go, before I hang my medication, I'm going to go ahead and look at my patient's insertion site to make sure there's no phlebitis or infiltration, redness, or swelling present, and their site looks good. So now I'm going to go right ahead and prime my tubing. So I'll go ahead and spike my medication. Make sure it is clamped, because I don't want any of it to come out flying. So I'm going to go ahead and move my primary . My primary was already labeled, but the labeling fell off. Okay, and what what I would do with my primaries, I would actually lower it down and hang it right beside my piggyback. So I'll go right ahead and prime my piggyback, and that is primed. Right back up. Okay, so at this time, I'm gonna go ahead and unclamp everything from my primary, so I can let my piggyback run. Okay, and I will go right ahead and attach my piggyback to my primary. Make sure I'll clean my port. Make sure this is cleaned as well. And I'll go right ahead. And so everything else is clamped in the primary, so I'm going to go ahead and unclamp my piggyback so just the piggyback medication can run. Of course, I forgot to mention, I will also insert fluid into my chamber. And at this time, I'm going to go ahead and establish my flow rate. And my flow rate, we said earlier, is 33 drops per minute, but I will establish it for 1 minute. Okay, so 33 drops per minute. There we go. Okay, so at this time, I will make sure to let that run, and I will also continue to look on it periodically. And once my medication is done, I'll go ahead and remove my gloves real quick. Alright, so I'm gonna throw that in the trash. Once my medication is done, I'll go right back into my patient's room, make sure I wash my hands, and apply new drugs on. Okay, I make sure to re-identify my patient so I still know I have the right patient. And then I will go right ahead and, since my medication is done, and go ahead and clamp my mini bag. And I'll go ahead and unclamp everything in my primary, so I can let that now run. And I'll go ahead and remove my piggyback. At this time, I will make sure to put an alligator clamp on it and hang it for next administration. Okay, and now at this time I'll make sure to once again look at my patient's site to see for any adverse reactions. And before I do that though, I'll make sure to reestablish my flow rate for my primary for 1 moment. And my flow rate has been reestablished. Okay, so I will once again go ahead and look at my patient's site and to see if my patient had any adverse reactions to the drug. Okay, and my patient, there no adverse reactions to it. He's doing good. And I will also make sure to look for any infiltration, phlebitis, or redness or swelling, and there's none present. And I will make sure to clean everything in my belongings, or everything that I have used, and put my sharps in the sharps container and move everything else to the trash. And I'll make sure to keep an sight on my IV insertion for any tenderness or pain. And now I'll move on to documents, and I will document the time, the drug, and the dose and the route, and then also document my document the site of the IV insertion, which was no redness or swelling or infiltration, and the intake and output, and also minister how my patient tolerated procedure, and I believe my patient tolerated procedure well, and I believe that completes the VI piggyback.